Good afternoon. This is the Odessa Coronavirus Task Force. We're going to start off with Brandy Garcia from the Ector County Health Department.
Good afternoon, everyone. We'd like to thank you for taking your time to come and be here with us today. I'm Brandy Garcia, the Director of the Ector County Health Department. Due to the significant amount of calls received and the concerns circulating through the social media and the public regarding coronavirus, also known as COVID-19, the Health Department, along with county officials, city representatives, and all of our community partners, felt the need to provide an update to the community on our ongoing preparedness efforts to keep our community safe from the virus. It is important for the community to know at this time we have no confirmed cases of COVID-19 in Odessa or Ector County. It is essential for our residents to be aware that in the event we get a positive case, we will immediately inform the public. Again, at this time, we have no confirmed cases. Our department will continue closely monitoring the situation as information continues to update. The Health Department will continue working closely with the Texas Department of State, the State Department, and follow the guidance from the Center of Disease Control and Prevention, along with our active engagement with local hospitals, emergency responders, healthcare providers, and other essential community partners who all play huge roles in our ongoing efforts to ensure the safety of our community. At this time, I'd like to turn it over to our epidemiologist, Amrinder. He is with the Health Department, and he has been monitoring the coronavirus and working constantly with the reliable state sources and our local health care providers.
Thank you, Brandy. I'm going to be talking about our job responsibilities that we have been doing in the health department in the community. So the Ector County Health Department is closely monitoring coronavirus disease situation in Ector County. We continue to coordinate our local, regional, and state partners. Ector County Health Department activities so far have included monitoring any persons under investigations, or we call them PUIs, arranging evaluations for them and coordinate testing, collaborating with hospitals and providers to quickly identify any persons under investigation, and sending out timely and accurate information in the form of guidance documents and information updates. At this point, there are no confirmed cases in Ector County, and the risks to residents remains low. If a positive case of COVID-19 is confirmed, the health department will provide communication to the public and media. The population at elevated risk is elderly population with comorbid conditions. So if you develop fever and symptoms of low respiratory illness like cough or shortness of breath, within 14 days of travel to areas where COVID-19 outbreak is happening, you should call ahead to your healthcare professional and mention your recent travel or close contact. Your healthcare professional will then assess you to determine if you need to be tested for COVID-19. The CDC does not recommend people who are not sick to wear face masks to protect themselves from the respiratory viruses. These face masks are designed to contain your respiratory secretions and not to filter the air that you breathe. So it would be more helpful for people who are sick so that they can protect others from being infected. The testing is now available at 2 large commercial labs, LabCorp and Quest Diagnostics. So physicians now do have the ability to order tests at their discretion based on the clinical judgment and exposure history of the patient. Meanwhile, at the health department, we are continuing our testing at our public health lab in Lubbock. Any positive test results from the Lubbock lab would be considered presumptive positive, and those presumptive positive will be confirmed by the CDC. Currently, there are no vaccines available to prevent coronavirus disease. However, there are certain steps that we usually take to prevent the spread of flu and common cold that would also help to prevent coronavirus disease. And they include washing your hands often with soap and water for 20 seconds. If not available, use hand sanitizer. Avoid touching your eyes, nose, or mouth with unwashed hands. Cover your mouth, nose with a tissue or sleeve when coughing or sneezing. Avoid contact with people who are sick, and stay home while you are sick, and avoid close contact with others. Thank you. Now I will hand over to the Chief Nursing Officer from Medical Center Hospital, Kristen.
Good afternoon. With the current concern for the COVID-19 that we've discussed, our community hospitals are meeting on a regular basis to ensure safe care of our patients, our staff, as well as the community, all in conjunction with the health department. So some of the things we've coordinated we wanted to make you aware of. We are having weekly calls to prepare our facilities and to ensure that we're all doing the exact same thing according to CDC guidelines. So every week the hospitals do have a facility call to work through any of those CDC guideline changes so that we're prepared for anything that we need to fix on our side. We are having internal weekly meetings at our facilities just to deal with stress of operations, our supply issues, and any of the medication issues that we foresee coming to us. We also are closing entrances. That's a new thing that we've done this week. And that's really to enable us to screen visitors properly before they come into our organization. We're asking screening questions according to CDC guidelines, and moving forward, you'll be seeing us taking temperatures. So what we ask the community is just your compliance and understanding. It takes a little bit of a process to see every person that walks through our facility doors. I know at Medical Center alone, yesterday we saw 1,150 people. So there's a large population that comes to visit, and we want to ensure that you're safe just like our patients are. So please, we do ask from both facilities that you are compliant with the questions and anything that we're asking you to do, even if that means we ask you not to visit. One other thing we're doing is eliminating internally with our hospital staff, travel, unnecessary meetings. We hold a lot of community events at both facilities. So we are eliminating those just because we don't feel like those are essential to patient care, and that's what's most important at this time. The other thing we're doing is coordinating with our county officials because we do have an emergency management plan in place. Both facilities coordinate with the city as well as the county to ensure that proper resources are here. We're all doing the same thing. We're all on the same page. So we are working on making sure that we're compliant with everything that the county has for our emergency management plans. So now I'll turn it over to Chief Alvarez with the Odessa Fire Department.
Thank you. Good afternoon, ladies and gentlemen. As for Odessa Fire Rescue, during a large-scale infectious disease outbreak, such as the COVID-19, Odessa Fire Rescue will find it necessary to make the adjustments in our daily operations and our staffing within the department. The objective of this plan is to minimize the negative impact on the health and wellness of our personnel, their families, and the citizens of our community. So in our initial action plan, what we're going to do is, number one, we're going to minimize the risk of infection to our personnel and their families. Number two, continue to provide essential services to the community. Number three, we have to gain and maintain situational awareness, and we're doing that through our emergency management. And that's through the State Operations Center, where we're getting daily updates from them as well. Our personnel are trained. Our personnel have the proper equipment for this type of response. We do have two patient isolation devices, which are called isopods. We do have two of them, and we are going to strategically locate those in certain ambulances and certain stations. One of the things that the public does, if they make a phone call to 911, call 911, they're going to be asked certain questions, additional questions, so we can start that screening process so our personnel know if they need to wear an N95 mask and those other extra precautions. So we're doing that as well. We do have some procedures in place for the nursing homes, where we respond to the nursing homes. If they have a contaminated patient, then we're going to ask them to bring that patient to us instead of us going inside the nursing homes. More than likely, one of the things that we'll also do is scale back on our public education, public outreach. I'm going to ask the public that please don't come to the stations with large crowds, with a lot of people. And also, one of the things that we have annually is our open house and our fire prevention week. So we're probably more likely gonna be canceling that, so. This time I'll turn it over to Dr. Scott Murray.
Good afternoon, everybody. Scott Murray, Superintendent, ECISD. In working very closely with Ector County Health Department, our city leaders that you see here, local medical experts, and with their full support, we are making the decision to open all ECISD schools on Monday. There are no cases of the coronavirus, COVID-19, in Ector County at this time. And we understand that this situation changes daily, and we may adjust these plans based upon any new information that we receive. Our health and medical communities are preparing for the illness to reach our community. And at this time, there are no illnesses. At this time, they are recommending that our schools maintain regular operations. Medical professionals agree most who contract the illness will have mild symptoms. Elderly patients and those with underlying health conditions are most at risk of the severe illness. We will be giving close attention to our most fragile populations who may be at higher risk in ECISD. As a measure of safety and effective immediately, the following actions will be in place. All non-essential travel for staff and students is canceled or postponed until further notice. This includes athletics, fine arts, academic contests, and conferences. Second, all non-essential gatherings, events, and meetings are canceled or postponed until further notice. This includes PTA meetings, booster club meetings, and community meetings. Third, all non-essential visitors and guests will be restricted from visiting our campuses until further notice. This includes non-essential volunteers and mentors, parents eating lunch with children in the cafeteria, and others. Before spring break, ECISD custodians began above and beyond cleaning at the end of each school day, with a special focus on touch points like door handles, faucets, sinks, desks, chairs, and tabletops. That work continued with more cleaning during the spring break period and will continue as we place soap in all restrooms and ensure that it is maintained in all restrooms in ECISD, and spray bottles containing bleach, a bleach solution, will be located in each of our classrooms. We will continue to follow the recommendations made by the Centers for Disease Control and the Texas Department of State Health Services, as well as our local leaders and officials. We are encouraging all students and staff to stay home if they are sick. The most common symptoms of the coronavirus are flu-like symptoms: fever, cough, sore throat. Again, we are encouraging students and staff with any of those conditions to remain at home. If you have these symptoms, health officials recommend that you call your doctor and avoid contact with others. We recognize as a school system that this is an evolving situation, and we will be flexible with our decision-making as we receive any new information or guidance. We will continue to work with our local, state, and national leaders, as well as our local, state, and national health organizations to keep you informed and to keep you safe. The health of our staff, our students, and our community is our top priority. Thank you. Mr. Mayor.
As your mayor, I continually closely monitor the threat of novel coronavirus, now officially known as COVID-19. There are no confirmed cases of COVID-19 in the city of Odessa or Ector County. However, this is a rapidly evolving situation. With the ever-changing situation in the coronavirus, the leaders of Odessa have formed the Odessa Coronavirus Task Force. This task force will be meeting on a weekly basis to make sure that we are all on the same page and we know what's going on in each of their organization. Public officials indicate that there will likely be more U.S. cases in the days and weeks to come. If a case is confirmed in Odessa, we are ready to respond. The Ector County Health Department routinely investigates and contains infectious diseases and is well prepared to handle the case of COVID-19. Although this is an ever-changing situation, this is not a time to panic. If you have not been around anybody with COVID-19 or have not visited an ongoing outbreak area, you are currently not considered to be at risk. I propose Odessa being an example for the rest of the country to help flatten the curve of the COVID virus. That means avoiding non-essential gatherings. There are several city events that will be canceled. We have decided in the best interest of safety, health, and well-being of the public to cancel the Spring Fling events scheduled on April 11th, 2020 at UTV Park due to the threat of coronavirus. In the Spring Fling includes the Bunny Hop 5K Fun Run, Easter Egg Hunt, and the Kite Flying Festival. The city and downtown Odessa recently made the decisions to cancel Tap into Downtown out of the abundance of caution. Social distancing is a great tool, as is avoiding large crowds. There are additional ways to combat the spread of this disease. People should also practice routine, healthy hygiene habits to prevent the spread of the illness like COVID-19, such as washing hands frequently, covering for coughs and sneezes. Avoid touching your eyes, your nose, your mouth, and staying home if you feel sick. I also want to remind the citizens of Odessa, there is no need to go to the emergency room unless you have a medical emergency. Emergency rooms need to be able to serve those with the most critical needs. If you have any symptoms like cough, fever, or other respiratory problems, please contact your regular doctor first. And now, County Judge Hayes.
Thank you, Mayor. You know, as I stand here in this room and we are surrounded by great leaders, all of those that are all behind me, from the beginning of an ER doctor all the way over to your department head for our county health department. The mayor and I could not be more proud of those that are behind us and of our community. We are fully aware that at some point our community is going to have a person that is going to test positive. But because that your leaders of your community have been so proactive, for example, on March 3rd, when we all went to the polls to vote, your Ector County Elections Office was already preparing for sanitation and cleaning of your voting machines and had sanitation cleaning jails at all facilities. So we were already ahead of the curve and trying to prevent and protect our community. I want you to know that the majority of the individuals that have contracted the virus are 80 plus years old. Those that are in the age of 0 to 9 have not been affected. They have not been affected. So that is one reason why your school system is opening, because they feel that your children are going to be safe going to school. Now, that's not to say that in a week from now, 2 weeks from now, that they might make a change to their school system. But we will notify you of that change. Any change that occurs in your community, you can go to the Ector County website page or the city page to find what events have been canceled or if there are any changes in your community. Now, the governor today announced that the state of Texas is in a state of emergency. Now, that sounds really horrible. Now, I'm not going to try to dumb that down, but I'm going to try to explain to you why he did that. The reason that he did that is because in order for your city or your county to receive any federal funds for any cost that we incur or lose during any shutdowns, events, or cost, we are eligible to apply for federal dollars for reimbursement. So that is why the governor took that stance today to declare an emergency. It's not because that Odessa is in a state of emergency or the state of Texas in an emergency. It is because that allows us to be able to receive those federal funds. So again, I cannot thank those that stand behind me and beside me to protect each and every one of you in our community. I think at this time we're going to open it to questions. Does anyone have a question? Yes, ma'am.
Do we know if anybody has been tested for the virus in Ector County at this time?
I'm going to address that to our epidemiologist.
We are monitoring patients and we are coordinating testing for people under investigation, but we are gonna make a public announcement only if we have a confirmed case.
Do you know a number of how many people are being monitored or anything like that?
We only will be talking about the confirmed cases.
Okay.
Thank you.
But you are confirming people are being monitored.
Yes.
And I want to add to that, the reason that he is only going to tell you when you have a positive case is because that we are still in a flu season. And so there are lots of people within our community that are testing positive for the flu. So if we were to tell the people in the community that we have 1,000 people that are being tested for the flu, that would put panic in our community. And we are just not going to do that to our citizens. We are not going to do that. So that is why we are only going to tell the media and the public and the community when we have someone that has tested positive, because we are still in a full-blown flu season, which is a normal flu season.
Are there any testing protocols for people coming back from vacation, maybe through the airport right now?
That would probably be a Midland question, because that's Midland International Airport.
At this time, we're unaware of any.
The CDC does, however, give guidelines of people that are traveling from various areas, what testing, the screening and testing that may need to occur based on where they're coming from. So again, whether it's Midland or the airport or any travel, whether they're flying or not, they're going to be following those CDC guidelines.
Yesterday, you probably heard that Texas Tech University is not allowing the students to come back. What happened is they went on spring break. So who and where they went, nobody knows. So that's a precautionary measure. So that's why the students are not coming back from the spring break. It's a different situation. Also, we have some workers and some of the faculty and some of the staff who went and took some cruises around the world. Those are not allowed to come back to work. They have to self-quarantine themselves until symptoms are manifested, and then we go from there. The self-quarantine should be around 14 days. Additionally, it's very important to clarify that we have a plan into place when you call your doctor. What happened when you call your doctor? Somebody is going to screen you to find out, first of all, if you have one of the issues that cause you to be concerned. Second, if that is the case, for instance, you went to Italy and you came back, then the second step is to find out. You can self stay at home, and then from there, if you have mild symptoms, that's the way again to stay at home. If you have moderate or severe symptoms, then the physician that is in charge of you is going to decide if you need testing or not. According to the CDC, everybody who is sent by a physician to be tested is going to be tested. So I think that clarifies some of the difference that you have seen today regarding age, basically.
And related to that, University of Texas Permian Basin, as you saw yesterday, expanded our spring break by 1 week. The purpose of the expansion was not that our university is unsafe for students. Obviously, we know, as we've talked today, that there are no confirmed cases right now, and things are progressing, in that way. The reason that we expanded our spring break was really to make sure that our faculty can come back and to come up with very contingency academic plans in the event in the future that we have to go online. So I think, as you look at the educational institutions across the state, there are a myriad of plans that institutions are putting in place, and most of the plans are those pre-active cautionary ways to put us in line to be able to act quickly if we need to make a different decision. Thank you.
There was one point that we did not cover, and that is our nursing homes. because that those that are in our nursing homes are the most vulnerable to catch this disease. So we are asking our nursing home facilities to please go through the CDD questionnaire, which they are, and they are also taking temperatures of those that are coming in to see their mom or dad or their loved one. So we would just ask the public to be very compliant with that, because it's not only for your mom or your dad or your grandma's protection, but it's for your protection as well. So if you would just spread that for us, that would help us a lot. And it would also help the EMT offices as well.
We'll go ahead and wrap this up. Just quick comment. One of the things we do not want to happen is people rushing to the testing center if you have no symptoms. We do not want to inundate the testing center with somebody that woke up with an allergy sniffle but having no other symptoms, and they go down there, because we need to keep these professionals ready for the people that might become sick. Everyone here is open for interviews or questions, so we'll go ahead and close this press release or press conference, and anyone's welcome to come up and talk. Thank you very much.
Judge, real quick, I think all of us would like to know. You mentioned panic, and I asked this question out of all due respect. There was a panic yesterday that somebody tested positive. It started a rumor gossip mill inside MCH. We had doctors calling, or at least relating that information to us. And so people are now starting to call. Is there any way that the health department can be proactive? Because the community is looking to the media for answers. They're looking at our Facebook page first, not necessarily y'all's. Is there a way that the health department can be proactive every day and to send out 1 or 2 releases, 0, 1, 2, whatever the numbers are? That way we can know that at that point in time, there are no positive cases of coronavirus.
That if we get a positive case,
But I don't know how long that's going to take, and I can't trust how long that's going to take.
as soon as we get it, we will immediately put a press release. We will immediately release that.
Okay, you got to believe that I'm skeptical about that. So I don't want to tell people no just based on the last time we talked, because the last time until this news conference was yesterday about 4 o'clock when you and I talked on the phone. So I don't want to assume 18 hours later that the news is still the same.
But you see, that's the exact point. The news isn't the same. If she was to put it on her website, there are no cases, okay? So she puts that out every morning. But the what if game, what if by 3 o'clock there is?
But I would rather hear from her at 9 a.m. than not hear anything at all.
So we're just gonna
And assume that there
post.
are no cases
We're just
until
gonna
she calls
post
us.
if there's a case. If there's a case, we will
All right,
post
we're
it
gonna
on our
hold you to
website.
that.
And we will. But if there's a case, we will post it.
What do
on
you
our
mean by
website.
posting it?
It'll be posted on the website.
What, the
And
health
you-
department website?
Yeah, plus there will be an email.
We will send out
an
a
email.
release. We will send out a press release to all of you saying that we do have
A positive
this
case.
situation, and we will set up a time to do a press conference with you. But we will send the release out first. Immediately, we will send that release. So if we haven't sent the release out, then we don't have any confirmed cases to send. And at this time, we do not. So the gossip going around is just gossip.
But I feel that it's our responsibility as the media to help calm people down, because they're not getting any response from you guys when these rumors pop up, because you have nothing to report. I'm the one that has to go find out, is it true or not, and then report back to them, no, just gossip today, no MCH case.
And as right now, there's not any. Now, maybe Monday there might be. Wednesday there might be.
And you
In 2
all
weeks from now, when we get, everyone comes back from spring break and the gestation period is covered, then there might be. The chances go up. But what we're trying to do today is to take that curve and bring it down. And that's what we're really trying to do. So right now, we don't have any cases.
And you're all welcome to call the health department. You can speak to myself or Amarinder and ask if, we got this information, is this true? And we will confirm or not confirm that information.
And the health department is underneath the county. So as soon as there is a case that is known and positive in this county, my office will know. my office phone number is 498-4100. And so myself or my staff is available to answer whatever questions that you have.
And as hospitals, we do ask that we defer to the health department. We're both getting multiple phone calls every single hour about these, do you have one, what's going on? And we are deflecting everything to the health department because they are our one source for the county. So anything that we have, any phone calls, we're going to ask you to please confirm or ask any questions to the health department.
And unfortunately, because of the virus, the everyday patients that our clinic sees at the health department is still continuing exactly like with both of our hospitals. So we're limited with staff, and we're trying to spread ourselves as best we can, but this virus and the protection of our community is the utmost importance to our county and to your city. That is exactly what we're trying to do.
Okay. Y'all are welcome to come up and get interviews.